Osteomalacia is a medical condition characterized by softening of the bones due to impaired mineralization, primarily affecting adults. It is often caused by a deficiency in vitamin D, calcium, or phosphate, which are essential nutrients for bone health and mineralization. When these nutrients are lacking, the bone matrix becomes inadequately mineralized, leading to weakened and softened bones. The hallmark of osteomalacia is bone pain and muscle weakness, which can vary in severity and location. Common symptoms include dull, aching bone pain, particularly in the low back, hips, and legs, as well as muscle weakness and fatigue. Individuals with osteomalacia may also experience difficulty walking or standing for prolonged periods due to weakened bones and muscles. There are several factors that can contribute to the development of osteomalacia. Vitamin D deficiency. Vitamin D plays a crucial role in regulating calcium and phosphate levels in the body, which are essential for bone mineralization. A deficiency in vitamin D can impair the absorption of calcium and phosphate from the diet, leading to weakened bones. Dietary deficiencies. Inadequate intake of calcium or phosphate can also contribute to osteomalacia. Calcium and phosphate are essential minerals for bone formation and mineralization, and a lack of these nutrients in the diet can impair bone health. Malabsorption disorders. Certain gastrointestinal disorders, such as celiac disease, inflammatory bowel disease, or gastric bypass surgery, can impair the absorption of nutrients from the intestines, including vitamin D, calcium, and phosphate. This can lead to deficiencies that contribute to osteomalacia. Renal disorders. Kidney diseases or disorders can affect the body's ability to regulate calcium and phosphate levels, leading to abnormalities in bone mineralization. Conditions such as chronic kidney disease or renal tubular acidosis can increase the risk of osteomalacia. Medications. Some medications, such as anticonvulsants, corticosteroids, or proton pump inhibitors, can interfere with vitamin D metabolism or calcium absorption, increasing the risk of osteomalacia. Diagnosis of osteomalacia typically involves a combination of medical history, physical examination, blood tests to assess levels of vitamin D, calcium, phosphate, and markers of bone turnover, as well as imaging studies, such as X-rays or bone density scans DEXA. Treatment of osteomalacia aims to address the underlying cause and replenish deficient nutrients. This often involves supplementation with vitamin D, calcium, and phosphate, either through oral supplements or intravenous therapy, depending on the severity of the deficiency. Additionally, treating underlying medical conditions or adjusting medications may be necessary to improve bone health. With appropriate treatment, the prognosis for osteomalacia is generally favorable, and symptoms often improve as bone mineralization is restored. However, untreated osteomalacia can lead to complications such as fractures, deformities, or chronic pain, highlighting the importance of early detection and intervention. Overall, osteomalacia underscores the critical role of adequate nutrition and vitamin D in maintaining healthy bones and preventing bone disorders.